Okay, so what we're going to do today is the ELISA. And remember, the ELISA is looking for antibodies. So every time that we do an ELISA test, we perform a triplicate. What does that mean? It means that we are performing a test on each patient 3 times just to make sure that we're not getting any false negatives or any false positives. So the first thing that we're going to do with our ELISA is we are going to use the simulated antigen, which is basically the disease-causing pathogen. So what we're going to do is we are going to add it to our wells initially. So you notice that I have our wells here labeled 1 through 12, rows A and B. So what we have is we have patients A through F, and we have a positive and a negative control. And with that, again, we need 3 different wells for each patient because we're testing them 3 times. So we're really going to be using rows A and B entirely. So the first thing that I'm going to do is I'm going to take 3 drops of the simulated antigen, and I am going to add it into each one of these wells. And as I'm adding the simulated antigen, I'm making sure that I'm not actually touching the pipette into each of the wells, and the main reason being is because we don't want to have cross-contamination. So I'm just going to start that practice immediately as I start this process. So once again, first thing that we're doing is adding 3 drops of the simulated antigen into each one of the wells. And again, that is rows A and B. So once that's done, I don't want to cross-contaminate, so I am immediately going to actually just place that used pipette to the side. So now what we're going to do is we are going to add the samples. And so the first sample that we're going to use is our negative control. So in this sample, it's basically serum that does not have the antibody in it. So what I'm going to do is I'm going to add 3 drops into row A, wells 1 through 3, because remember, we're testing this 3 times to make sure that we're testing each patient correctly. So that's our first one. It's just our negative control, so we should not see a color change with the ELISA. Our second one is our positive control. So this serum actually would be like blood plasma of the patient that contains the antibody. So we want to see what a positive reaction looks like. So again, we're going to add that now, this time 3 drops into wells A4, 5, and 6. Once we're done with our positive and our negative controls, we are now going to start working on our patients themselves. So our first patient, this is a patient we're testing. It's patient A. We don't know whether they actually have been exposed to the disease-causing organism or not. So now we're going to add 3 drops into wells A7 through 9. Now that we're done with patient A, we're going to move on to patient B. So patient B is our second patient that we're actually testing. And so we want to make sure that we get their test results also correct. So this time we're going to add it into row A, wells 10, 11, and 12. So again, the patient serum, this is basically what it's simulating the patient's plasma. So we're testing their plasma to see if the antibody is present. So these patients may or may not have the antibody, and that's what we are adding right now. And then we're going to test that further. So now I'm looking at patient C here. Patient C is our third patient, and that's going to go into wells B1 through 3. Once again, 3 drops into each well. Now we're done with patient C. We're going to go to patient D. Patient D is now going to go into wells B4 through 6. Move on to patient E. And patient E is going to go into wells B7 through 9. And our last patient is patient F. So patient F, again, is going to go into wells B10 through 12. So again, we're testing each patient 3 times, and the reason we're testing them 3 times is just to make sure that our results are accurate, because remember, the ELISA can be used as a first diagnosis for HIV, so you want to definitely make sure that your patient is positive and you're not giving them a false result. Okay, so now what we have is we have that simulated antigen, we have the pathogen in there, we have the samples from our patients to determine whether they carry the antibodies or not. We're not going to be able to see that. So the first thing that we're going to add to all of the wells after we add that antigen and their serum is we're going to add the secondary antibody. So once again, when we do this, we're going to add 3 drops into each one of the wells. And the simulated antibody, what it's doing is if the antibody is present from the patient, the secondary antibody is actually going to bind to it. So it's going to bind to that initial antibody that the patient has. If it's present, this antibody will bind to it. If the patient did not have the antibody, meaning they weren't exposed, then this has nothing to bind to and it's just going to be freely floating. This is going to be important because the next step, which is chromogen, is going to actually detect the binding of this secondary antibody that I'm adding right now to the binding of the patient's antibody if it is present. And then the very last step is adding chromogen. So chromogen is going to be the thing that actually goes through and does a color change. So that simulated chromogen, what it's going to do is if that secondary antibody, which we just added, binds to the antibody that may be present in the patient's serum, this chromogen is going to facilitate a color change. And so once again, we're adding 3 drops of the chromogen to each well, because again, we're trying to detect that secondary antibody that we just added in the step before this. If it bound to the antibody present in the patient's serum, this chromogen will detect that and facilitate a color change. So after we do all of that, we are going to sit and we are going to wait for the results. And so in this video, it looks like our negative control is actually a clearish color. It's almost got a green tint to it, where our positive control here, which is wells A4 through 6, is starting to turn purple. So the purple coloration indicates that we have a positive result and that the patient's serum does actually have the antibody in it. So within this video, this is just showing you how we run the ELISA. The results are actually in that lab PowerPoint.